morning, everyone, and welcome to Maine Public Health Association's 2020 annual conference. This is Heather Drake. If you don't recognize my voice by now, I'm the membership manager at NPHA, and glad to have everyone here in our virtual room with us and for attending our second week of our annual conference. This morning, we will be talking about public health data with Patrick Madden, who is the research director at Market Decisions Research, and I'll kick it over to him. But just before I do, please don't forget to complete this session evaluation that you can find in the same spot where you logged in to view this morning's presentation. And also we'll be taking questions for Patrick at the end. So please feel free to ask them throughout the presentation, or you can wait until the end, whichever is easier for you. But either way, use the ask feature that's located on the conference website and in the conference app. And I think that's it from me now. So Patrick, thank you so much for being with us this morning. We're really looking forward to your presentation and learning more.
Well, great. Thank you, Heather. Happy Friday, everybody. Happy to be here. Happy to be talking about data today, something that I'm very passionate about. So this is Maine Public Health Data Training. To start with, just to let you know, I have nothing to disclose with regard to commercial relationships. Also, just wanted to acknowledge that this presentation and training is funded by the Health Resource and Service Administration. You can see the details of this grant on the slide. We would like to thank HRSA for funding important trainings for the public health workforce through the Public Health Learning Network. A little bit about me. Heather sort of already introduced me. I'm research director at Market Decisions Research. I've been doing this for quite a bit of time. I started there way back in 2003, so closing in on 20 years at this point. I actually started there as a research analyst. Over this past, 18 years or so, I've evaluated and conducted data and research on a number of public health programs and for public health agencies around the state, inside Maine and outside Maine. Things like, the Old Healthy Maine partnerships, the community health needs assessment in Maine and outside of the state, a number of community transformation grants, and a lot of other public health research and evaluation over those years. So, and I'm happy to sort of share my experience and sort of what I've learned over that time with everybody today. So again, happy to be here. So the purpose of this specific training is to understand, obviously, some basic public health data terms, identify Maine-based public health data resources, understand a little bit more about how to gather and analyze basic public health data for assessment, planning, and evaluation at the ground level. So, the purpose of this particular presentation and training is not necessarily make us all epidemiologists. We don't need to be, but it's really to sort of pull away the curtain on data to show that, really anybody can do it. And there's ways, certainly, public health data analysis and evaluation, it can be really complicated, but it doesn't have to be. And we can all sort of do it in a way that is systematic and keeps things simple and uses resources that are available to all of us. And what do I mean by that, right? So this is something I run into quite a bit when I work with clients, everywhere, right? So a lot of people sort of have the idea that data is scary, it's overwhelming. So, and especially as the amount of data that is around us that we work with increases, that fear of it also increases, right? So even when we look at the definition of, what a public health system is, data system is, like that's a very heady definition, right? That is not what I would call user-friendly. And so I would say, the purpose of this presentation is really to, it really aimed at like this, the person who thinks it potentially has been intimidated by data in the past, has, potentially some fear of it, doesn't know where to start, might be overwhelmed by the data and everything that's out there. But, potentially realizes that it's useful for what we do today. So we're going to pull back that curtain today and show with some real examples of how we can do that. Because we all can do it, and we all have to do it because it's embedded in everything that we do, right? So if we look at the CDC evaluation framework, it's part of that, gather incredible evidence and justifying conclusions. It's part of the MAP assessment. So again, conducting sort of the needs assessments, evaluating what's going on. So everything through the planning of what we do, through the program implementation, through actually evaluation of our public health programs. Data is a really important aspect of that. And we use it in sort of a number of different ways, right? It's used for grants. And I actually serve on grant evaluation committees. And I can tell you, there is a big difference in terms of grants that actually use data. And it doesn't have to be a lot of data, but just uses it in a very simple way to identify what the needs are, to really quantify those, and then has some specific metrics around, okay, here's the things we're going to do with this grant funding, and here's how we're going to evaluate whether it's worked or not. And to be perfectly honest, the grant applications that do that well are more likely to be funded, right? So data is an important part of that grant making process. Sustainability, obviously. So if you are funded, funders actually want to some indication of whether their funding has been useful, whether it's been effective, has an impact, and the need for continuous funding over time. Process improvement. Again, if you have a program, identifying areas where interventions are potentially underperforming, how things can be improved over time, and of course, advocacy, right? Highlighting the need for new programs and interventions, both at the state level, federal level, and within our own communities. And again, we use it in a number of different ways, right? From the beginning, right? The assessment process, basically understanding what are the health needs of the community in the first place, using data to do that. For planning purposes, again, how can we redesign this program? How do we really effectively deliver the programs that we need? Process improvement, as I mentioned, and evaluation, really understanding, okay, I did these things. Has it had the impact that we expected? And of course, this might have been a tougher sell if we had done this presentation last year. But I think with everything going on in the world with COVID and the pandemic, I think we all realize how important data is in understanding what's going on in the world, right? I mean, how many people are actually checking the CDC website or news on a daily basis, sometimes multiple times a day, to really understand what's happening with COVID and with the state and with our communities, right? And this data that we're collecting and this data that we see drives a lot of the decisions that are happening with regard to whether businesses are open and closed, whether we're working remotely or in the office, whether schools are remote, hybrid, or in school. So all of this data is really important to us, not just on some sort of theoretical level, but really driving day-to-day decisions. And as a result of COVID, we can all see that, I think, really clearly nowadays. Now, Maine actually has quite a few. We're in a good place in terms of data in the state. Certainly, it's a lot better than we were even 5 years ago. There's a lot of great public health data sources in Maine. There's the behavioral risk factor surveillance system. There's the Office of Data Research and Vital Statistics. The Maine Integrated Youth Health Survey provides data on youth in the state. There's a lot of great data sources out there. And what I think we're trying to do in this training is provide some resources around facilitating people identifying these and accessing them and understanding what's in them. Because even for myself, it can be a complicated thing to really understand everything that's out there in the state and that's available to us. So one of the things I'm hoping to part with everybody attending today is the idea of how to identify a good data source. And all the ones that I had just shown on the previous slide, those are all quality data sources. But obviously, if you do this, you'll run into some that are not so good. So how do we know if data source is good or bad? The number one key is actually transparency. Transparency is critical. We want to know how data was collected, what it consists of. And if a data source doesn't do that, already you can be skeptical that it's a quality data set. So again, we want to know what the source is, who is funding it, who's potentially collecting the data. You'd want that hopefully to be an independent organization, state agency, something like that. But that could potentially help you understand if there are potential biases in terms of the funder, what the population is. So, what's the overall group actually being represented by this data set? The sample, again, unless it's a census, you want to know how people are actually being selected from the population to reflect that population, and the methods behind that and how that's done, and if that's accurate. The data collection methodology, it's always important to know, okay, where are the data coming from, right? Is it administrative records that are being pulled into a data set? Is it actually from a survey? And if so, how is that survey being conducted? The sample size, again, just how many records are in the data. And what we typically find is that, and the key here is that many times overall, your overall sample size will be fine, right? Even for a small survey, if you collect a survey of 200 people or 400 people, overall, that sample size is fine to tell you what you want to know. The problems we typically run into when you start analyzing data, especially at the community level, is if you have enough data within those important subgroups. So, if I'm part of a small community and I want to pull data from a survey that maybe have 400 or 600 or 1,000 people, and there's 10 people in my community that actually have done the survey, that's where I start to run into problems. So, it's not just the overall sample size, it's the number of the sample size within whatever specific subgroup that you're analyzing. And that's really key. Margin of error, we've sort of all heard about, right? So if we do a study of 400 people, our margin of error on our survey is plus or minus 5% and 95% confidence. And that just represents the sampling accuracy of the study if it is a random sample. And many of the surveys and data that we have nowadays actually aren't random samples. They cover online surveys or something like that, which technically don't have a margin of error because they're not randomly sampled. And yet we still do it anyway because people like to know that. Also, very important, but not as talked about, surveys and data collection have many other types of error that we don't really talk about because they're much more tougher to measure. Things like specification error, non-response error, measurement error. Now, non-response error is a big one nowadays. So if I did a survey, a population survey of health, and only men responded to that survey, um, and I presented that as, okay, here's what the community thinks, there would be biases in that data because no females responded to it. And the differences between those two groups in terms of their healthcare needs are very stark. And that's the idea of non-response error. And that's a big issue nowadays because our response rates to a lot of studies that we conduct are very low. So we really need to be careful about who is responding to the survey. So when we talk about sample, it's important to understand who's actually responding to the survey and do they reflect the population that we're trying to represent. And then the timing of it, when was the data collected? And what we find in public health data is there's often a lag between now and what the data is representing, often a year or more. And we've gotten a lot better here over time. It used to be that data was 4 or 5 years old that we were looking at, but a lot of organizations have done a better job recently of moving that time frame up. Just some examples really quickly of 3 different data sources, just to show you, sort of the good and the bad. You have something like vital records through the Division of Data Research and Biostatistics at Maine. The population here is all residents. Everybody has a birth certificate and a death certificate eventually. Um, and so it's a census. It has, 99+% coverage. There are some incidents where certain birth certificates and death certificates don't get into the system, but that's very rare. So the coverage here is excellent. The one challenge with something like vital records is that our most recent data is from 2019, so it's a year old, which oftentimes isn't a problem during the status quo. But when we have big changes in what's going on, something like COVID, where all of a sudden the world's different, what happened in 2019 is a limitation because things have changed. So that's often one of the limitations we face. Then you have something like the BRFS. The source of that's through the Maine CDC. They do hire a phone vendor to collect that data, so it is a phone survey. The population's all adults. It's supposed to represent adults 18 plus. However, the sample is actually not institutionalized adults, so it doesn't include people in group homes, doesn't include people who are incarcerated, who happen to have a working telephone and still want to do surveys. So it does tend to skew a little bit older, a little bit more female, although the response rate in Maine is still quite good. It has a 60% response rate, which is much higher than other states. The sample size, again, 11,000 people complete the survey every year. That's actually a very robust sample size. It has a very low margin of error. However, if you were in a smaller county in the state, once you start to only look at the number of people who completed the survey in, say, Piscataquis County, that's going to be a lot smaller. So that's where, again, where we start to run into potential issues. And then it's not a public health data source, but I didn't necessarily want to throw any of those under the bus, but I'm happy to make fun of SurveyMonkey in this case. So SurveyMonkey election poll, you can go on SurveyMonkey, you find this data. It's an online survey conducted by SurveyMonkey. The population, they actually don't say. It might represent all adults. It might only represent adults who are registered to vote. They're not really clear about that. The sample is people who take surveys on SurveyMonkey, and they route those people through this poll that they're doing. How many completes do they get in Maine? Again, they don't say. So it's unclear exactly what's going on there. As a result of that, and the fact that it's actually not a random sample, we can't calculate a margin of error, sampling error associated with this, which is an issue. So again, what we can already see is transparency is missing from this data source. When we look at the sample, it's pretty skewed. You wouldn't necessarily say people who take surveys on SurveyMonkey represent the adult population in Maine. Why would we use a data source like this in that case? Well, the trade-off that we have here, so we're trading off data quality for data recency. So again, there's data from October 2020 on current election poll status. So one of the, I think, challenges when working with data, and you'll face this as well, is the trade-off between recency of data with data quality. And the challenge here, the thing I want to leave you with, is that that trade-off can also often result in negative consequences, right? And we can look at the 2016 election as a case where our polls were wrong, right? So again, we were collecting data of lower quality, like we're doing now, and it told us the wrong thing, and we made the wrong conclusion from that. So again, be very careful when you're trading off data quality for recency and convenience, because it actually might lead you to the wrong conclusion. So I wanted to sort of bring a framework to this discussion, and this is something I use with clients on a day-to-day basis in all my projects. And again, it's the idea of simplifying what we're doing. So when we look at data as a whole, when we look at the process of like an evaluation, it can be very complicated and it can be overwhelming. So let's simplify that into this framework, this sort of stepwise framework where we can go through one item at a time, starting by defining the question, developing the indicators, collecting data, and I put quotes around that because often you're not actually collecting data. And the same thing with data analysis. You're not typically analyzing data. So it's, again, something that everybody can do. And one of the things that when we were working on the statewide shared health needs assessment back in 2015 to 2016, the secret, a little dirty secret, is we actually weren't analyzing a lot of the data that we were pulling into those reports, right? We were taking data that other people had analyzed that was available already online, and we were just pulling that and putting that into a different format for these reports. So again, we're not analyzing data many times. We're just taking what already exists and we're using it for our own needs. We're pulling it into our own reports. And it's something that anybody really can do. And then communicating the results, reporting on the results. And going through those, step one, defining the questions. And step one and step two are really, in my mind, sort of the two most important things. And it's important to spend some time on these to get these right. And if you can do these right, the rest of the process is going to go a lot easier. So step one, define the question. Sometimes this can be easy, right? So if you have a logic model that's already developed for the program, it would be tied right to that logic model and might come right out of that logic model. Same thing if you have sort of grant funding, a grant that you developed, an evaluation plan, it might already be really, the questions might be defined in there or come out of there. If not, you really want to tie your questions to what are the goals of the program. And that's a really important thing, right? Because again, we could have a million questions sort of out in the air, and it'd be great, nice to know this, and I want to know this and this, but really focus on, well, what is the program? What is the intervention really trying to achieve here? And those really should be the questions that we want to answer. Always, involve other people, staff, stakeholders, partners. They provide a really, I think, unique perspective. Um, Again, they're often intimately involved in the work, so they'll be able to tell you stuff that you might not know, or provide, again, a perspective you might not have thought of. And here, and I'll stress this, I think, throughout the presentation, the training, we want to keep it simple. Um, and things start to go off the rails is when we try to overcomplicate things. And again, we might want to know 50 things. Some of those are going to be really easy to answer. Some of those are going to be really difficult to answer or really time consuming to answer. And the thing that we face with clients sometimes is they want to get everything answered at once. Well, you know what? If we look at any framework, if we look at sort of the CDC evaluation framework, it's circular. So this should sort of be a continuous process. So we don't need to answer everything at the same time. We can stage our questions, and the best way to do is let's start with the easiest ones. We'll answer those first, and a lot of times just doing that, it's already going to put you ahead of everybody else. It's going to tell you a lot of stuff you didn't know, and you can always loop back around to get to the more difficult questions later. Step two, develop the indicators and metrics associated with those questions. And to me, this is the process of taking the more general and making it specific, or the process of getting specific. And what does that mean exactly, right? So if we're dealing with secondary data, it's the idea of, okay, well, identifying the variables um, that are out there that are going to answer our questions. And if we're dealing with primary data or our own data collection, it's the idea of sort of identifying the survey questions that we need to ask to answer those questions. So getting specific about um, the geography that we're looking at, the specific populations that we're looking at, really defining in very specifically what we're trying to get at. And again, it's really important to involve others in this process, including the experts, people who deal with data on a daily basis. Important to note, one question may require multiple indicators to answer, and that's okay. Sometimes they require many, many indicators, as I'll provide an example later, and often may require a time series analysis. So the important thing here is because to measure change over time or to measure impact often requires a pre and a post. Ideally, it requires a pre and post. Um, so do it at the beginning, right? Think about this stuff at the beginning of the process, not the end. A lot of times we're pulled in at the end of a program or at the end of an intervention, and people want to measure the impact of it. Well, it would have been great to actually have started this at the beginning, so we would have had some baseline data to do that. So just start thinking about this at the beginning of the process. So what does that look like? Again, provide some examples of what we mean by this. So one example of an evaluation question we might be looking at is sort of what are the most critical health needs in this county, and an example indicator of that, getting specific about that. And again, sometimes it's easy, is the rank of the most critical health needs in whatever county we're dealing with. Could be Oxford County, could be something else. Another example, does the community have sufficient access to transportation services for healthcare, for example? And this is where we could have multiple indicators. So one indicator could be the number of rides provided by the transportation services providers in the community. We could also look at the number of people who have missed or avoided care because of a lack of transportation. If I was running a colorectal cancer screening program, the evaluation question I might be looking at is actually, did the CRC screening program actually reduce cancer incidence in the state? And that could be, again, be part of my logic model that I've developed for this program. And of course, the indicator there would be, as a start, to be look at the colorectal cancer incidence rates in the state over time to see if that's declining, or at the very least, has stopped increasing. Step three, data collection. Identify the data source for the indicators. And again, many data sources exist already, right? So make sure you review secondary data sources that are out there. They want to make sure they match your population and timeframes and things like that. But it's likely that many of this stuff is out there. So go out there, go to the source whenever possible. That's important. And data should be credible, obviously. You don't want to misinterpret or use bad quality data just because it's convenient. Despite my background, as a survey methodologist, we're not really going to get into primary data collection or surveys in this particular presentation. Maybe that's the second one next year, but because it can get complicated. But if you are required to collect data, conduct a survey, really, I just want to stress, make sure the data doesn't already exist. Because you don't want to go out and collect data that's available from somewhere else. That's not a great use of resources. And then again, if you have to do it, keep it simple. You may already have participant lists, community emails. You can use that, use tools, um, because it can get complicated. And so an example of our data sources, right? So again, if looking for a rank of the most critical community health needs, a data source that where that's available is the Maine Shared Community Health Needs Assessment. For example, number of rides provided by transportation service in the county. You can get that from the Office of Maine Care Services. The number of people who have missed or avoided care because of lack of transportation. I'm currently not aware of a source of that, a secondary data source of that. So that actually might have to come from some primary data collection. Cancer incidence rates, obviously available from the Maine Cancer Registry. And COVID, if we were looking for COVID data, we could get that currently from the Maine CDC. So again, these are just examples, but what we find here is that 4 of our 5 indicators have data sources that are currently available. And a little bit later, actually, as part of this effort, we've created a resource that we want to make available to everybody that will help facilitate identifying data sources. And I'll show you that in a few slides from now. Step 4, analyzing data. The big tip here is actually many times doesn't actually require you to analyze any data. Why is that? Because a lot of times we're just copying or downloading data from existing tables, maps, etc. So again, this is something that anybody can do. You don't need to be a statistician. You don't need special statistical software to do it. You don't even need to be particularly good at math, right? So we're just taking and downloading data, copying data over from maps and using it for our own purposes because it already exists. It's already there. There's already people doing this work to provide this data out there. We can just use it for our own purposes. We just want to make sure it sort of aligns with the data indicators that we've identified in step 2 of the process. And again, even if we're collecting our own data, there's plenty of tools available, very simple tools available that we could use. So if we collected the data in something like SurveyMonkey, it has analysis and reporting tools built into that that we can use to help us analyze the data so we don't have to do it ourselves. And communicating results. So this, people make entire careers out of data storytelling, data visualization. So again, we're going to just touch really briefly on something that can get really complex, and there's a lot out there. But if I could part any sort of words of wisdom in terms of communicating results, the big thing is really to identify what is the story that you want to tell with data and how the data you have really is going to support that story. And what I mean by that is not to make up a data. We're not, again, if you've been on social media, the idea of sort of making up statistics to support a fictitious case that you want to present. But what we're doing here is really taking the data we have and weaving it into a story. Now, even myself, somebody who deals with data all the time, like having a million data points around isn't a particularly compelling case. But what people respond to is the idea of a story. And it's really important. It's a really good skill to have to be able to take data and turn that into some sort of story. And one of the ways we can do that is by keeping things simple. And again, we don't really want to be making a lot of infographics and things like that. And unless your infographic tells a specific story again, it can actually take away from the data. It can be confusing. So if you just throw a bunch of stuff on a page on a screen, and there's no coherent storyline there, it actually makes things more confusing. So we want to keep it simple charts, simple tables in terms of presenting data. Again, there's a lot of freelancers out there who will provide data visualization services for actually pretty cheaply. Or there's a lot of built-in tools that you can use. Again, one of the most common ones, Microsoft Excel and PowerPoint can do a lot, right? You can analyze data in Excel. You can present data just fine using Excel. You can also use Google Documents, which is completely free if you didn't want to spend any money at all to do data visualization. Again, as I mentioned, there's built-in reports and analysis tools in a program like SurveyMonkey if you have to collect primary data. And if you wanted to take the next step in data visualization, Tableau is a common tool. You'll see that out in a lot of websites nowadays. It is more complicated, so it would require some training to use properly. But again, it's a way to produce maps and things like that actually pretty easily. So as I mentioned, so one of the parts of this process and this training we're providing is an actual resource that people can use. And this is a great thing. This has taken us a lot of time to build, and it can be a great shortcut for people out there. So this is something. It's on a website. Out there, and I'll provide the link to it later. But we wanted to provide this resource to everybody. So this is something that we've sort of developed over time at Market Decisions Research to support our own data analysis and our own evaluation work. And it's a list of about 100 different um, indicators around the state, what the data source is, what the specific website is. So if I actually clicked on that link right there, it would actually take me to the actual data. It would take me to that table. Um, and then information around what types of geography it's available on, what different types of demographics are available by it. And this could be a great shortcut, an amazing reference to, again, identify not only what indicators and data sources are available there, but a shortcut to actually get them. So this is an awesome resource. It took a ton of time to develop. So um, I highly recommend checking it out if you do this type of work. It can be a great shortcut to save time. And even for us who do this on a daily basis, it's always it can be challenging to know what's out there, what's available for data. So this is a great resource. We really wanted to sort of share this with everybody as part of this. And it covers a ton of different topics from demographics, socioeconomics, healthcare, oral health, maternal child health, substance abuse, tobacco, a bunch of different categories. So this is just an example of some of these indicators and data sources that we wanted to make available. And what does that look like specifically? So if I clicked on this link to the census data, this population estimates, I would come to something like this, right? So here's the census website. This is what it looks like, redesigned in advance of the census 2020. And that I actually would admit they've done a really good job redesigning it and made it really, I think, much more easy to use than it used to be. If we look on this, on the left sides are indicators that we can click on. On the right side, we actually have our data, which includes counts and margins of errors and things like that. The census allows us to filter by geography. And the great thing about the census is actually can um, get data down to the zip code level, which is great if you work, in smaller communities in the state. If you're really working on the community level, to be able to get community level data is an amazing thing, and it can be really helpful. There's a search bar on the top if you wanted to search for specific data. It will tell you right there what the data source is. In this particular case, it comes from the 2018 ACS estimates. Um, so the census uses it for a lot of information around population, household income, household characteristics, things like that. These are the county health rankings, provides a lot of information on health status and health indicators from things like the BRFS and other surveys like that. And this isn't the original source of the data. They compile statistics into one website, which we're seeing here. But what I found is something like the county health rankings is actually much easier to use than actually trying to get like the BRFS data from the CDC. Because it provides it all here. It provides drill downs by county. You can select specific metrics right there. It has a nice dashboard. It allows you to download data right there. Provides maps, so you could actually pull those maps into reports if you needed to. So again, a good website for compiling a variety of public health statistics into one specific area. Here's the website from Maine Data Research and Vital Statistics, a great place to get information, again, on vital statistics, birth statistics, death statistics. What we're seeing here is some maternal and child health statistics from the website. This is Tableau, as you can see on the bottom. Tableau is a nice way to present data. Again, it provides maps that allows us to look at the actual table and the data itself. Tableau is great because we can download it into a variety of sources there on the bottom. There's a nice dashboard, uh, provides drop downs where we can actually start to drill down on specific categories if you want. So, another great resource for vital statistics in the state. Here's data from the Maine Community Health Needs Assessment, again on the CDC website. It provides a little bit older at this point, but it is going to be updated for 2021. So we'll have some new data here pretty soon. The great thing about, much like the county health rankings, it compiles a bunch of different health statistics from different sources into one area. So again, if you're say working in the community and you want to understand, what are the top health needs of that community, instead of going to 25 different data sources, you can go to someplace like here and get it all in one place. It also provides trends over time, which can be really useful to see if changes are occurring, and will help flag significant differences to see where things are, significantly higher or lower than the state or something like that. So again, it's going to be updated soon, and provides a great resource for a bunch of different health indicators all in one place. Now, I wanted to sort of end with a little bit of an example. I'm a pragmatic guy. I love examples and presentations. So we can sort of show how we can use data. So an example of how, I would do it. And it doesn't take a lot of time. We're not going to use any special software here. We're not going to use any complicated math or anything like that. But we'll show an example of how this can work and how you can do it, how anybody can do it. And so the example we'll look at, because it's very topical, would be COVID-19. So one thing we could do is really want to understand more about how COVID-19 has impacted different racial groups in Maine and identify if any disparities exist by race in the state. Now, if you've may have been paying attention to the news, you may already know the answer to this question. Um, but even if you do, it's still a good example to see, like, okay, what's the data behind the news that I may have seen? How do we get there? And we can show you the sort of stepwise process to sort of get at that answer. And we could use this data for a lot of different things, right? To quantify the extent of the problem in the state. Again, really understanding the needs. We could use the data if we were applying for grants to address whatever issue we found. Or if we identified something, we had a program in place or an intervention in place, we could use the data to start to evaluate the success or the impacts of that community intervention. So what does that look like? Again, we'll go through that framework, that stepwise process, one step at a time. So step one, define the questions that we want to answer. And the first one, the sort of overarching question that we want to answer is, are there any racial disparities in the impacts of COVID-19 in Maine? And we can have some sub questions associated with that to get a little bit more specific. We can look at, are there differences in COVID-19 rates by race? If so, if there are differences, what are the reasons for those disparities? And then how has this changed over the course of the pandemic, if at all? Step two, we can start to develop our metrics and indicators. So again, sometimes that's very easy. So if our question is, are there differences in COVID-19 rates by race? The obviously indicator that should be associated with that is incidence rates of COVID-19 by racial categories. Similarly, if you want to look at change in the pandemic over time, we can look at that very same thing, that incidence rate over time, and that will start to get at some of that question. The challenge that we run into is when we want to know the why. So if we want to know, okay, well, if we identify that disparities exist, why is that? That's where things often start to get complicated, is the why. So we could need to look at things like demographics, what are the demographic differences by COVID cases by race, things like age, gender, location, what's the socioeconomic differences, things like income and poverty, employment, occupation. We might want to know sort of what's the knowledge differences by racial, categories around the dangers of COVID or what the safety protocols are. And of course, we may want to look at the barriers preventing adherence to either the guidelines or access to care. So again, here's where we get into a situation where that one question we want to know ends up being a very complicated thing. So this certainly in the aspect of this presentation, we can start to look at the easy things first, at least to get a sense of that. But step three, if we wanted to sort of identify what the data sources were, if incidence rates of COVID-19 by race, great, it's actually supplied by the Maine CDC. Provided that link at the bottom, many of you may have already been to the Maine CDC COVID-19 tracking website, which is extremely useful. Um, the one thing they actually don't provide, however, is incidence rates by race over time. They provide it by race, but not necessarily over time. But fortunately, there is a source out there for that. So the COVID tracking project takes all of the state data provided by the states and they compile it into a time series data set. So I've provided that link. So we can actually go to covidtracking.com and we can pull the data that's provided by the Maine CDC. It's just tracked in an easy to access way by this website. The why question, that gets more complicated. So again, in terms of secondary data sources, there may not currently be any of those yet for this information. So if we wanted to get at things like understanding the knowledge and the barriers associated with health disparities in the states, we may have to turn to something like primary data collection. And that could be something like key informant interviews if we wanted to talk to stakeholders, people running agencies, providers, things like that, to get at their sense about what's going on. We could also possibly do a community survey where we talk to different racial groups to understand what their challenges are, again, what their knowledge is, what the barriers they've experienced. But again, both of those things can be complicated, they're time consuming, and potentially expensive to do. So the why is always a tough question. Collecting data, we can turn first to the Maine CDC website. So this comes right from their dashboard provided on that website I showed you. Not what I'd call a pinnacle of data visualization. It is what it is. This is a Tableau table, but it does get us the data that we need. And again, collecting data, we're just pulling this from a source that already exists. We're not doing anything special here. And if you hover over one of those bars, you get the pop-up that you see on the right side of the screen, which actually shows things like cases, population, all of the data that we start to need to start to analyze the problem. So what I went through is I actually hovered over every one of those and entered that into an Excel spreadsheet. So I took that data, I put that into Excel. Again, no real analysis needed, just an Excel table, and start to pull out information on cases. We have cumulative cases. So if we look at sort of the African American population here, there have been a total of 980 cases that have been identified as, having a race of African American, compared to about 3,800 cases for those who've identified as white, out of a total of about 5,500 in the state. This was pulled last week. So we can start to see, okay, well, amongst the African American population in Maine, they actually represent 18% of all cases, all COVID cases in the state. If we look at the next column, the population column, there are about 19,000 African Americans in the state of Maine. So they make up 1.4% of the population. So already what we can see is just by this one table, we can already identify a huge health disparity amongst the African American population in Maine. And again, you may have seen there's a lot of news reports around this earlier in the year about Maine's issue with this. And we can calculate an incidence rate based on those two numbers, which is really the only math that I'm doing here, which is just the number of cases divided by the number of the population times 100,000. And that's our incidence rate per 100,000, which is just the number of cases that would exist within that segment if they had a population of 100,000 people. And by doing that, we can see that the incidence rate amongst the African American population in the state of Maine is over 5,000. That's 10 times the amount of the state. A huge health disparity, right? Which would be an understatement. Also other races as well, significantly higher overall than the state. And we could take that, say we were writing a report, say we wanted to write a grant to address this problem, we wanted to, start a program to address this. You could take this table, you could put that in your report, and that would be fine. But we could start to communicate these results. And this is my example of what I mean by storytelling. So we can start to simplify what we're trying to say and weave that into a specific story. And one way we can do that is by visualizing the data. So we can take that table and we could turn that into a very simple chart, right? So we're just charting the incidence rate of COVID cases. And what that does is that takes that and it makes that difference extremely stark. And you can see those huge differences in those bars between, say, the white population in Maine, the Caucasian population, and that amongst the African American population. A huge difference if you look at that. Another way we can do that is to start by collapsing data and really focusing on, again, the population that we're interested in. So if we look at the pie charts on the right, it's really presenting, focusing on the African American population compared to, say, the Caucasian population in the state. So again, it's telling a very similar story in a slightly different way. But either way, it goes to show that really quite a huge disparity going on in the state. And here's the second piece of data. So we can actually look at this over time. And so I pulled data from the COVID tracking project, just download the data. It came in a CSV file. So again, no special software, not analyzing data. It was a data set that I put in Excel. I did calculate a 14-day moving average. So the blue bar is the cumulative cases over time. And that's just a percentage of all COVID cases in the state that have a reported race of African American. And again, what we end up with now in October is that 18%. So 18% of all COVID cases over the course of this pandemic have identified as African American. But what happens is when we look at that over time, you can see it early in the pandemic, back in April and May, um, a huge, I wouldn't even call that a disparity. Like, this is beyond a crisis. This is crazy what was going on at the beginning. So at the high point of that 14-day moving average, there was a point in time in May where 62% of all COVID cases over that previous 14-day period were African Americans. And this is a population that's 1.4% of the state. So again, this goes beyond a health disparity. And this is why Maine made national news at the time for its real lack of what was going on amongst the African American population, and real serious inability to address that. That's huge, right? That is beyond huge, uh, even beyond a crisis. And they made changes. There were changes that happened in June that sort of went to address that. So if you look now, what's going on in October, that 14-day moving average is down to 4%. But again, it's 1.4% of the they make up 1.4% of the population. So it's still a significant health disparity, still 3 times higher than it should be. So it still exists. It's just not as insane as it was back in May. So again, and by doing this, it starts to get at, okay, understanding what was going on, and no special analysis needed, no special software needed. All I used in this case was Excel to analyze and present this data using data that was already out there. So I just want to leave with a couple things before we leave you. Sourcing data, very important, right? And again, I tried to source all the data that was used in this particular training. It demonstrates credibility, so people look at the data, understand where it comes from, and the context of it. And of course, one of the underrated things, it helps you remember where you got it. So if you have to go back 6 months from now or a year from now, and I have to update this, I know exactly where this data came from. I can hopefully click on that link, and makes my life much more easier. So I don't forget where this data came from. It wouldn't be a presentation about data and analysis if there wasn't a limitation slide, right? We love our limitations. So there are a lot of challenges that I didn't necessarily talk about. There are time lags, which in a pandemic is a particular challenge, right? So we don't really have a lot of understanding how things have changed due to COVID-19. So if we have a lot of data from 2019, oh, that's great about what was going on last year. It's not so great at understanding what was happening now. And in a lot of our studies that are going on now, that's really been a challenge to not only understand how things have changed, but to address how that's changed as a result of COVID. If you work at the community level, obviously, a lack of community level data is often a challenge, especially in Maine, where we're dealing with a lot of smaller communities, a lot of rural communities. Getting data at that level is often a real challenge. Same thing with a lot of our at-risk populations, or those experiencing high health disparities. We don't have a lot of great data on racial and ethnic minorities in the state, the LGBTQ population, homeless populations, where it's more difficult to actually collect data from a transient population like that. And as a result, again, maybe not having sufficient programs in place, as we saw with COVID, to provide the support and the programs that are needed amongst these populations. And of course, sometimes secondary data often doesn't exist for our indicators or the data that we want. And primary data can often be expensive to collect. So if I can leave you with one thing, remember to use the framework. It does simplify things. Going through a stepwise process, you find that it does make that process easier, much less overwhelming when you address it. And finally, the resources. As I mentioned, the Maine health data resource list, a great thing. We showed that to you earlier. Available on mainepublichealth.org. Check it out. Definitely use it. It's extremely helpful. If you want to go a little deeper into this, there's a great resource on public health practice around epidemiology and the basics of that. The Stanford webinar series, so Stanford University produces a great webinar series on data. They actually have a lot of different webinars. A lot of them are actually free. The one I'm linking to here is actually on data-driven storytelling, an important aspect of what we do. And they're all great. A lot of my colleagues have done these this summer. There's a great book on storytelling with data. And it says it's focused on business, but it actually crosses a lot of different industries. And it's really one of the most well-done books on data visualization. And then if you haven't checked it out already, or if you're not part of it, and you do public health evaluation or analysis or research in the state, check out the Maine Evaluation Society, which is a great place to connect with other professionals and people in the industry. And with that, I appreciate your time and happy to answer any questions.
Thank you so much, Patrick. That was a great presentation, and I know really helpful for folks who don't work day to day in data, as it can often be overwhelming. So we appreciate you giving that overview and that training. I'm now going to turn it over to Jennifer Gunderman, who is with the University of New England and a MPHA board member, to help facilitate our Q&A.
Hello, good morning. Patrick, so we did have one question in the box, but TT from UNE, who I know well, wanted you to remind us the Maine Public Health resource that you had included in one of your slides that had the demographic, socioeconomic factors and the different links. But you're at the end of the presentation, you were able to remind us what that additional resource was. So thank you for bringing it back to that resource for us. I don't see any questions in the ask right now, but I do have a question. So the topic of the Maine Public Health Association conference this year is One Maine, One Health. And we know that the concept of One Health is around how we look at health within the context of the environment, animals, people. So how would you sort of describe how we can use data better within that One Health model? Thank you.
That's a big question, Jen, and a very good question. So, I think that I have to think about that a little bit. But, I think one of the things we had conducted some research for Maine's outdoor recreation program. And I think one of the things we had sort of experienced with that particular project is the idea of, and it was specifically about sort of understanding sort of Maine's opportunities for outdoor activity and how it sort of incorporated with a lot of different aspects of not only public health, but ideas around conservation, ideas around like public health, land opportunities and things like that. So I think in particular that one study we found, and we did a big survey around that, is that the idea of and a concept like outdoor recreation touches on a lot of different aspects, right? The idea of like, One Maine. It touches on ideas of the environment. It included questions around that. It touched ideas on public health. So the idea of, outdoor recreation as a way for people to experience and to get, experience public health and health opportunities. And it's a way, whether it's, things like cycling, running, mountain biking, getting out there it's a way for all of us in the state of Maine to have opportunities to experience public health, no matter where we are or what we like to do. Um, and it touches on a lot of different things. So, I think something like that where, again, we have data around all of these different aspects that sort of link together with regard to the state. And if any one of those things falls apart, again, the idea of like land conservation um, is an important aspect of public health, right, in the state. So all of this stuff is linked together in terms of how we operate and how we work and play and have a healthier society.
Great, thank you, Patrick. And my background's in infectious disease epidemiology, so my brain goes to like West Nile virus, Lyme disease, and so I think it's helpful to remember that it's bigger than vector-borne disease. And so I appreciate your response. So another question I have for you is that one of the things that we hear quite often, the buzz or the buzzwords are big data. And that can be a really overwhelming thought for people who just want to use local, meaningful data for making decisions. But could you, within that context of thinking of big data, like what do you see for, like if you had a crystal ball, what would you see the future of public health data and some innovations? I mean, I remember when GIS mapping started to kind of hit the scene in public health, and we were doing all these overlays of mapping and learning some really key things. But like with the experiences that you've had, if you're going to look into your crystal ball, where do you think public health data is going?
Yeah, well, I'll just, one of my pet peeves is the term big data, right? Because I think it's one of the things that, well, it's died down a bit, but for a while, that's something everybody was saying, but nobody actually really understood what it really meant. And people are using it in all sorts of incorrect ways. But I think in terms of public health data, and we've seen this over time, well, I think one of the really important things that we want to see in public health data is the ability to get more timely data. And we've seen that with the response to COVID, right? So again, even 5 years ago, we used to wait years, multiple years, like 2, 3 years to get a data source. And we'd be okay with that. And I think what we've realized now is we can't wait that long anymore for data because the world's changing. And to really understand what's going on, again, both in terms of infectious disease and public health, we need sort of more timely data. And there's a number of ways to do that, right? So there's been a lot of experimentation with like crowdsourcing data. Again, the idea of, people actually acting as conduits, like data collection conduits, through things like the idea of wearables, right? So if we have our Apple Watches, we're a data collection machine in terms of when you think about something like public health, right? How many steps we're taking, how much activity we're getting, things like that. So the idea of being able to collect data in a more timely manner, and the idea of crowdsourcing it, so that data can come from a variety of different sources, and hopefully get to us much quicker, for us to look at that in a more real-time aspect to it. Now, there's certainly challenges with the idea of like crowdsourcing data in terms of especially data quality. We want to make sure that the data that we're getting is still valid and is done in a way that is not skewed or anything like that. But those are two, I think, areas that are driving areas that I've been seeing lately in this particular area.
Great, thank you. One last question to end us off today. Patrick, you're stranded on a deserted island. What is the one data source you're going to take with you?
I'm sure I have to take data. I can't take something else that actually might be more useful in that sense. But if I were stranded on a desert island, and am I looking for a way off? Did you say public health data source?
Yes, one public health data source that to do all your work, what would it be?
Whew, that's a tough one. And as a guy who does a lot of survey like research, that would be a very tough one for me. I would probably say my go-to public health data resource in the state would be the behavioral risk factor surveillance system. Um, Again, there's going to be a lot of limitations if I only choose one, but it does provide a wide variety of health indicators at the state and county level. So it covers a lot of different topics. So for me, that would be an important thing. Um, as we also noticed, the sample size is pretty big, so you'd be able to dive down, I think, in terms of some specific subgroups and things like that. So it's a data source I use a lot in my day-to-day work. Um, and that would be a very tough decision, but I'd have to go with that.
Great. Thank you, Patrick.
Hmm?
Heather, I transition it back to you.
Yes, thank you, Jen, for helping with our Q&A this morning. And Patrick, thank you again so much for being here and giving your presentation. It's definitely really helpful, and I think will shed a lot of light on data and evaluation for folks who are using it in their day-to-day work or who might just be interested in it. So it is just after 10, so we'll need to wrap up here, but please remember to take the session evaluation, which you can find on the session page right where you access the live stream by clicking on the feedback button as a send a push notification, so you can view it there as well. And what other announcements am I forgetting? We will be offering closed captioning next week for the final 2 weeks of the conference. So please stay on the lookout for more information on that. You can find it in the left-hand menu of the website. And otherwise, we will be back in about 10 minutes with our public health nursing panel. So I hope you will all join us there. And thanks for participating for our first session this morning.